Lakshmi Ishwaran. I'm a senior consultant obstetrician and gynecologist. I have a clinic named Sai Specialty Center in Kasturi Nagar, and I also work with Cloud9 Hospital HRBR. I hope you watched the previous video on BITS and Bytes digital wellness on PCOS, which is one of the commonest problems that women face now. Today's topic is on fibroid uterus, which is again one of the, I wouldn't say very common, but not uncommon either. Topic which is of very, it's very important to talk on this topic because many women are not aware of how these fibroids present. The fibroid uterus is also called leiomyoma, and it is basically an excessive growth of fibrous tissue in the muscle, that is what we call the myometrium of the uterus. When there is an excessive growth of fibrous tissue, it forms a relatively firm mass in the uterus and slowly grows in size. Basically, it's an estrogen dependent tumor, so it's more common in the reproductive age groups and more common after. It can be very common from the time you are about 17-18 to the time you reach menopause, and it regresses only after menopause. Now, what is the other than the estrogenism that causes fibroid uterus? Women have this hereditary tendency to have fibroid uterus. So if your mother or your maternal family or your paternal family, any of the ladies in the family have had fibroids, you have to be on the lookout for fibroid in your later life. So during pregnancy, it's usually detected sometimes. Sometimes in a pre-pregnancy workup, you tend to see fibroids. It could be one of the causes for infertility. Now, sometimes fibroids are picked up near menopausal age or perimenopausal age. Now, what are the symptoms with which fibroids present? So, most of the fibroids are actually asymptomatic, and when it's asymptomatic, it need not be treated. But when it becomes symptomatic, say 20% or 30% of fibroids can become symptomatic. When they become symptomatic, they usually present with heavy bleeding, associated with pain, and there can be a little bit of bladder or bowel symptoms depending on whether it is in front or behind, and whether it is compressing on the bladder or on the on the bowel. And it can also present as subfertility in women who are trying for a pregnancy, and these are the commonest ways in which a fibroid presents. Now, when you have these kind of symptoms and you go to a gynecologist, the first thing she would ask you to do is to see whether you have a fibroid or any other associated problems, of course. But since we are dealing with fibroid, I continue on to talking about it. So when you do a scan and you see that there is a fibroid, there are 3 different types of fibroid depending on the location that it sits on the uterus. So it could be a subserous fibroid when it is sitting on top. That's the least symptomatic fibroid because it is away from the inner lining of the uterus or in the musculature of the uterus. So it tends to cause the least kind of side effects or symptoms. Then you have something called an intramural fibroid, which is in the inner musculature of the uterus, and that tends to cause a little bleeding if it is more towards the inner lining of the uterus, or what we call an endometrial cavity. The third type of fibroid is what we call a submucous fibroid. This is the most, this is the one which creates the maximum menace because it's in the inner lining of the uterus and it's highly vascular, so it tends to cause more bleeding. And these are the fibroids which are more symptomatic. Now, this can also cause infertility because it is in the inner lining of the uterus, where if it is in the area of the fundus or the upper part of the uterus, it tends to cause, it prevents the implantation of the baby into the uterus. Or if it's near the opening of the tube, it tends to block the tube, etc. There are other exceptional fibroids like broad ligament fibroid, etc., etc. But I think this is the basic nature of the fibroid. Now these are estrogen dependent tumors, means any lady who's ovulating and who's having a regular period tends to grow these fibroids, because the first half of the cycle in any of the menstrual cycle in any woman has estrogen in it, so it tends to grow the fibroid. As and when the fibroid grows, it creates more and more problems. So it is very, very important to suppress the fibroid. Very, very rarely these fibroids can turn out to be a cancer. Like say a 0.3% of fibroids can turn out to be a cancer. And it's very difficult to diagnose that, and only when you evaluate and when you remove the fibroid and you send it for a biopsy, you tend to know whether it is changed into a sarcoma or not, or a cancerous changes or not. Otherwise the symptoms are quite the same, and any fibroid which is increasing in excessive growth has this condition also has to be thought about. Now, how do you diagnose? I have said most often it is with a scan, and treatment is basically either conservative or surgical. Now, in a younger age group where fertility is very important, unless and until the fibroid is symptomatic and it's causing some kind of obstruction towards fertility, either in terms of blocking the tubes or blocking the opening of the tubes into the uterus, or it's in the area of implantation, or it's too big that it makes the uterus weak to carry a pregnancy, we don't think of surgical options. We think of options where we try to help the patient conceive faster, with a little support, and try to carry through the pregnancy, because pregnancy is a progesterone rich state, and any progesterone rich condition is against estrogen, so it is an anti-estrogen, and it tends to stop the growth of any fibroid. So though the fibroids increase in size in pregnancy, they tend to, after a particular point of time, they regress. So smaller fibroids can be dealt with that way. Of course, degenerative changes can complicate a fibroid. Fibroid uterus can make the uterus very heavy and cause cervical incompetence and other complications related to it. All that apart, most of the fibroids which are small and not placed in unless they are placed in the inner cavity of the uterus, usually does not cause any problems during pregnancy. When it does cause a problem, we do something called a myomectomy, that is, we remove only the fibroid, and we do it either through a laparoscopic method or through an open method, depending on the size. Most often we stick to laparoscopy so that the adhesions and the sequelae that follows after that will not harm the fertility later in terms of blocking the tubes or causing any problems within the uterus. Now, when it comes to a reproductive age group, once you've had children and other things, when uterus is an organ where it just holds your, your womanhood mostly, then the question of whether, it is worth holding back the uterus or not comes into picture. I would go on a more conservative mode, because for a lady, uterus is something like her heart. She doesn't like to take it away so easily, and it's very, very close to her emotions. And a lady who decides or wants to remove the uterus does it with a lot of pain in her heart. She feels that no, she is not a woman when she doesn't have it. So as much as possible, we go on a conservative route. Of course, a central or a local suppression with GnRH or progesterone is possible, but we cannot continue to do a systemic, inhibition to the growth of the fibroid continuously, because it has its own repercussions later on the the health of the lady. So we think of other locally acting progesterones, like progesterocerts, like an intrauterine device which releases progesterone. They are available in various names. I cannot tell the trade names, but that is what we do because it creates a local progesterone effect. So it's something like a intrauterine device, something like a copy or something like that, but it releases local progesterone and it prevents the growth. So when it is an intramural small fibroid or a fibroid which is lesser than say 4.55 centimeters, we can think of using this DigiNxtHlt or this intrauterine device which releases progesterone locally, which is active for about 5 years, and I've seen very good results with that, and that helps us sail through that period where you are perimenopausal and you need that uterus for your own well-being. So this inhibits the growth of the fibroid or any other tumor for that matter, and it prevents the periods from being heavy by cessating the growth of the endometrium inside. So this has worked wonders for many women, and because it's a progesterone rich environment that is created around the uterus, the fibroids lose its blood supply and it slowly starts regressing or at least decreasing in size. And at the same time, the ovaries continue to produce estrogen for the general well-being of a lady. Now, if all this doesn't work and there are obstructive problems and there are problems where patients don't adjust to these kind of devices like Mirena, or the fibroids are too big to be handled and it's slowly encroaching the ureters or the other organs, or it's rapidly increasing in size, it's always better to remove the uterus at that particular point of time, because the purpose, especially when the patient is more than 45 or 50, then the ovaries are more required for her well-being. Uterus which is creating a menace is better removed at that point rather than keep it and have complications like bleeding, anemia related to that, and your general well-being, your immunity, everything comes down. So it's important to give that well-being to the lady. She herself will say, I can't go on with this, and if Mirena has or the intrauterine device has failed, then it is better that we go ahead with surgery. Again, surgery is either laparoscopic removal of the uterus or an overall removal of the uterus, and unless she is entered into menopause and her ovaries are healthy, we need not think of removing the ovaries. So if the ovaries are having cysts, or you feel that it can be a problem later, and she is almost encroaching into menopause by the hormonal titers that you do, then and only then we think about removing the ovaries at that point. So this is the general way in which we treat fibroids. I go on a more conservative mode. I don't like to go into the surgical mode unless it's absolutely required, or I have a suspicion of the fact that this is going to create a lot of menace later, either in terms of obstructive problems or psychological problems or health issues and other things. So this is a gist of what I call fibroid uterus. I hope I have been able to cover most of this one, because it's just a 10-minute video. I had to just put it in a nutshell and tell you the basics of fibroid uterus. So be aware of it. If you see your tummy becoming more all of a sudden, or you have bleeding problems, please don't just think, no, maybe I'm going to go into menopause, maybe it's just because of some stress and strain. Please go and meet your gynecologist and try to evaluate yourself and rule out these kind of problems.